trying to develop better clinical guidelines and stuff. Can you say a bit about that, and particularly around the posture management work?
Yeah, because we treat a big number of patients with a disorder of consciousness, we always wanted to, we were looking for, in the very early days, for some guidance on how to manage these patients. So 15, 16 years ago, there was almost nothing. And slowly, as we started to apply our knowledge and skill, which we gained from various different trainings and courses we have attended, like the posture management course or the spasticity management using botulinum toxin, we then started looking at whether there should be a form of guidelines which will be useful as a reference document for professionals. Then we managed to put together a small group of 8 very experienced clinicians and academics who were supported with a pot of money to start looking at developing guidelines. And I'm very happy to say we are close to finishing the project, and part of which has been approved to be an annex to the Royal College of Physicians cdoc guidelines. To our knowledge, this is the first physical management guideline for people with a disorder of consciousness.
But could you choose 3 or 4 highlights about the guidelines that you'd want people to pay attention to, of your recommendations?
Yeah, one of the things is we have developed a flowchart which explains what needs to be done specifically with regard to positioning patients in bed, positioning patients in wheelchair, starting from the acute stages. So what should happen in the first weeks is something we have given some recommendations on. And then what should happen when the patient is in the rehabilitation phase? How quickly should the patient be provided with a wheelchair? And how frequently must the patient be reviewed by specialist clinicians who have experience, for example, in posture management, when they move into long-term care as well? So there is a lot of practical, useful information which will help therapists apply to their patients.